A locally based company, Proxy, has developed a tool to digitize health information like vaccine cards. Ed Dishner, the VP of Sales at Proxy, joins me now. Thanks for joining us, Ed. Hey, tell us a little bit about Proxy and its roots here in San Francisco.
Sure. We are a San Francisco-based company, ID verification and an access company. And what that means is that we digitize licenses and credentials such as COVID vaccination certificates to allow people to use their phones instead of plastic to get into buildings or even a local restaurant or bar.
And Ed, especially in the time that we have now, what is the importance of having your health information digitized?
Really a few different things. One is to make sure there's not the handing over of a plastic or of a paper card that can be easily lost, that can be easily, we were trying to go into contactless everything nowadays, and also being able to make sure that there's no discrimination on the different types of vaccinations that you receive. So we provide a service that allows employers to visually verify a vaccination card, but not necessarily provide any more information than the end user wants to provide with their consent.
There's a lot of fear with data getting out there and people finding out information that we don't want them to have about our personal lives. But there are a lot of benefits to having a digital record of your medical history on file. Can you talk about that?
Sure. We agree with that privacy first mentality. So we keep all of the information about you, a driver's license, your vaccination certificate on the phone. And again, only with the user's consent would they want to share that information with, again, an employer or a retail establishment. So there's no information on Proxy servers, there's no information at the company level, and we want to keep it that way. So the citizen or the end user has the full control of what information that they are going to be providing.
Ed, how is this different than having your vaccine card on, say, your Apple Wallet? Because that's available to people as well.
Yeah, absolutely. And I think throughout the U.S., there's Excelsior in New York, California has its state, and there's many other states that have their own, let's say, QR code. And this is something that we saw throughout the pandemic, where I go to a restaurant and I take a picture of a QR code and the menu opens up. And now Apple's being able to help standardize some of these. What we're being able to provide is a check-in experience also that's going to accommodate all of them. It has to have interoperability across the whole U.S. rather than just being either San Francisco or New York focused. This allows for that interoperability to be able to take any QR code from any state or any vaccination certificate.
Proxy is really working with HR teams and companies because now a lot of times at work we have to show vaccination status. Talk about the benefits of this on a company perspective, an employer's perspective.
Absolutely. It's known as RTO, or return to office, and now there's probably a hybrid looking forward where there's a lot of companies here, especially locally, that have announced plans not to either come back to the office full time or into 2022. And having, again, an interoperable, accept any QR code, and to be able to visually verify vaccination certificates gives employers an understanding of who has been vaccinated and start making decisions and insights based on that. For instance, if I have an office that is 90% vaccinated, then I might be able to more surely, confidently be able to open up that office as opposed to something in a different state or a different region that might not have that same level. So being able to make insights and decisions based on that information and to be able to verify that the vaccination certificate is valid.
Why choose the Bay Area as where you created Proxy?
I think that this is something where the founders were already here. They'd already created a different company, and there's just so much innovation here. I don't think that that is something that can be debated, but also saying that there's a lot of different around identity and digital identity. This was the area where I feel like not just the investment, but also the progressive nature of the companies here. We're seeing a lot of pickup and traction from these type of companies.
Okay. And Ed, having your vaccine card on your phone is so much different than just carrying around your piece of paper. I laminated mine as a safety measure. Can you talk about why having it on your phone is a much safer way to have that vaccine card?
Again, not having to be able to produce it. I just was recently traveling last week and pulled out my vaccination card 5 times. And being able to have to say, I'm going to give you a card, I just preferred to show it on the phone. And everyone was just visually verifying it as opposed to actually taking it and touching it. And being able to have this, and you mentioned Apple before, digitizing both IDs. They have 5 states so far that are digitizing the IDs. This is something where I feel like is a trend line that we're starting to see, where digitalization of identification of the vaccination certificates and now access to replace plastic cards are things that we're taking advantage of, and I feel like larger companies are also embracing as well.
And Ed, is Proxy specifically for employers, or is this something that just anyone can get on their phone and set up with their medical information?
Anyone can set it up on their phone. It's free for any citizen, any user to be able to do. And what we do is charge the enterprises or the companies to be able to track some of the information. And I don't mean to say track meaning that they're storing it. It's being able to track and visually verify it, and then that information goes away from their servers and from ours.
Ed, anything else you want us to add about Proxy?
No, I think that the key component is the privacy of the data, that it stays on the end user, that you're not having to actually hand your laminated or paper certificate. It allows employers not to have any discrimination against one brand versus the other, and you're only sharing the information that you need to share. Again, with the user's consent. That's the big point on the health, is to be able to have it work everywhere, interoperability, and have a privacy-first mentality, meaning we actually keep all the information on the phone.
All right, a lot of good information there on how to keep our health information safe. Thanks so much for your time, Ed.
Thank you. Nice meeting you.